back to the second day of Medicine X Ed. So how's everybody doing this morning? Good. Yes. So yes, I hope you were all energized to return to the second day. I know at the coffee outside, I was still I was talking with Hugo, a couple other people, and unpacking a lot of the lessons learned from yesterday, and a lot of those stories and a lot of those discussions are still unfolding in my mind. I hope they are in yours as well, and we'll keep those discussions going. What I thought we would do this morning is to talk a little bit about this conference and a little bit about how it came to be, how we put it together, because I think it's important to talk a little bit about how it is that everyone included actually comes to be. And I think that's an important discussion to have, because as you guys are living and experiencing everyone included and how it comes together, I think it's important to talk about the work itself, because you may say to yourself, oh, you want to take this experience and bring it back to your own work, and you want to apply it to your programs back where you are. And so we want to have a chance to talk about process, right, and how that collaboration happens. Before I do that, I do want to thank our sponsors. Of course, our delegates, you who, through your registration fees, help support the program, the patients and student scholarships and programs development here, the Stanford Department of Anesthesiology and the Dean's Office, who provide administrative support to help us come and bring this program to you, and also the Patient-Centered Outcomes Research Institute provides a generous grant to also make it possible. So with that said, the purpose of our session then this morning is to bring some stakeholders together. So who are the stakeholders here we have my co-moderator, Kirsten Ostherr, a medical humanities expert and public health expert, Bryan Vartebedian, a pediatrician, Matt Erlendson, medical student, Alicia Staley, breast cancer survivor and patient advocate, and myself, you know who I am. So I thought we would start off maybe with Genesis. Let's talk a little bit about what happened. How did this come to be? How did we decide to do this? And then how are we doing it?
I mean, on the education end, right?
This conference, yeah.
Yeah, it's interesting. I guess I was here from the first Medicine X and with the core Medicine X, and I think as it started to really take shape and take hold in terms of like the principles and the values, I think we had some really early discussions about how amazing the energy was that was happening here, and we started to think, how do we take this and sort of bring it into medical education? How can we infuse this into the next generation of medical educators? And that was probably like the first thing that started us discussing about Medicine X. Yeah, but we knew we had some challenges that we faced as well doing that.
Yeah, I think I think we saw a lot of creativity that was really looking to change the future of how we train health professionals. But the question is, how do you really make that change go forward, right? How do you kind of make sure that these ideas get into the next generations as they get trained so that they become the kinds of doctors and nurses and other health professionals that our patients in the room want? So education seemed like a really natural place to go to start to kind of seed that change.
Right.
Yeah. And I think from my perspective, having started Medicine X and having seen so many people go through our programs year in, year out, and we kept seeing some of the same misconceptions and misperceptions come back to us year in and year out. And then the educator and me kept saying,
right.
how do we get to the root cause?
Right.
And how do we maybe start earlier in the process to change those misperceptions and misperceptions. And I remember we were standing backstage one year and it was like, oh, we have to draw a line in the sand and make a declaration.
Yes.
We're just going to try to do something and change it.
2014.
Education. Yeah. So maybe Matt and Alicia, when we said we were going to do a conference on education, and we were going to take this idea of Medicine X, inclusivity, including patient voices. What went through your mind?
I think for me, one of the central tenets of Medicine X has always been about creating partnerships. And, starting back at Medicine X in 2011, I remember talking to so many patients who came up to me and said, this is the first time I've ever felt like an equal on stage next to healthcare providers who have taken care of me and really felt listened to. And I think that moving forward into education, we're trying to partner with students from all sorts of interdisciplinary healthcare professions, and we gain so much from partnering with patients. I think it's not just about talking about how can we change the schooling, but how can we actually create relationships that change the way that we view healthcare and change the way that we view patient care in general.
I think for me, from the patient perspective, I've been involved with Medicine X since 2012. The challenge for me has always been, where do I take what I've learned in Medicine X and how do I take that back to my community? And I think that with the added education that we pick, no pun intended, from Ed, there's an opportunity for patients to work with healthcare providers and educators back in perhaps their home hospitals in ways that we might not be able to do at a higher level, or change a whole policy or change a whole healthcare system. But I feel from my perspective, I've been able to work at my hospital with the graduate medical education program, and we've been able to talk about bringing in some of these the everyone included principles into what we do and the way that we interact with the medical students at the hospital. And we've built programs to integrate the patient voice and have patients participating in some of their classwork, in some of their seminars, in some of their grand rounds in ways that 5 years ago would have seemed absolutely crazy. So we're starting to see this slow march forward where the mindset and the methodology is truly being embraced in the community.
Mm-hmm.
So.
Yeah.
But there are challenges along the way for sure, right? Just having patients included, it doesn't end there.
Right.
As we discussed with continuing medical education on Thursday, once you have patients there, they have to know what to do, and then they have to be educated in terms of being great ambassadors for patients within medical schools.
And I think part of what is core to the ePatient program here is we are building a knowledge base for ePatients to connect with each other, to share some of the learnings that we have when we do go back to our communities. What works, what doesn't work, how do we make the process much more efficient? And that is the core of what we need to do as an ePatient community, is we have to make sure that we are supporting and training each other in a way that it is effective and appropriate to share with a larger community.
Right, because embracing the principle, it's not self-evident how to do that. Right. And you have to go into it with a certain spirit of experimentation, knowing that there's a risk involved, which is that the first time you try it, you learn a lot of things about what worked and perhaps what didn't. So I think that really having a space to kind of both explore those ideas, but figure out, what does this actually mean on the ground, I think is really important.
Absolutely.
Yeah, I think, in some way, I think you can run into the danger of, the 3 easy steps to everyone included. Just do these 3 things and you'll be everyone included. And I think embracing principles of inclusivity is the first step, but acting with intentionality, being consistent with purpose, and placing resources behind that intention, I think those are the critical follow-up steps, I think, that are also challenges. And being open, I remember our group, keep coming back to the CME workshop that we did, because it was this most recent activity where we were all together with an intense purpose and period of time. And in our group, we wrote down a series of principles about challenges, and one was, create a culture of trust where it's okay not to be right. And for us, at least at Medicine X, we're always like, we're so open to not being right. And we have to be, because when you're working with such a diverse stakeholder group, we just can't ever assume that our perspective is the right one, or that when someone comes to us, that our frame is somehow the majority view.
And that's rooted in our communication as well, as we saw with the keynote from Neha yesterday.
Yeah.
Just in the way we frame our conversations.
Yeah.
I think the key, though, is when you say everyone included, for me, the way that I perceive that, that's a grand declaration, everyone included. But it's also a very dynamic statement, because as we learn more, we can't say everyone included is just this.
Yeah.
And go back to our communities and assume that everyone included moniker is set in stone and we got it right on the first pass. So I think that for me, everyone included is a realization in my advocacy world that I need to make sure on a daily basis that everyone included is truly everyone included. So I have to make sure that for example, in the breast cancer community, there are great divisions, and there's issues with diversity and inclusion, and including the metastatic breast cancer voices in the full community. So as an advocate, I feel that everyone included has to be a dynamic venture. You have to be willing to step outside your comfort zone and say, hey, there are people that I need to do a better job reaching out to, and continually evolve what that means and continue to grow as an advocate to make sure that truly every voice is recognized.
So in my mind, and this is what kind of in my mind, I have the sub tagline underneath everyone included. So it's everyone included, sub tagline. It's hard. Everyone included, sub tagline. It's okay to get it wrong sometimes. It's okay to make mistakes, because inclusivity has to start somewhere, right? We can't start with the full house. People have to start coming in to the room, and I accept that we're not going to get it right, but that we want to learn.
But I think it means when somebody walks up to the house and knocks on the door, you let them in.
Right.
Yeah.
Right.
You don't.
Right.
You don't keep the door locked.
Right.
So,
Right.
Well,
Right.
because really, everyone included is actually about addressing a structural inequality that is a massive societal problem. It's not like just a problem at medical conferences.
Right.
It's even not just a problem within healthcare. It's a huge problem within healthcare, but it's much bigger than that. So, there's that, and then there's how we can redesign and co-design a different kind of space where there's a different model.
Or co-design medical education to fit everyone included, right? Which is really the purpose.
Yeah, I think just to chime in on that a little bit, I mean, just to take the everyone included model into the educational system, I think so many times health professional students are educated in silos from one another. So, you know, the medical students don't see much of the education that the nursing students get, or the occupational therapy students, or the social work students, or the pharmacy students, and you know, you can keep going on and on and on. But or getting really great interaction with patients themselves. I mean, how much time do you actually get to spend really getting to know a patient when you're in school? So, I mean, I think including everyone in medical education really just involves really breaking down these barriers and these silos that exist between students and between patients to get everyone involved and on the same page.
We had a really interesting insight, I thought, that started circulating around Medicine X Ed last year when it happened, which was that I think it might have been one of the medical student speakers who observed that there was a kind of commonality of purpose between the medical students at Medicine X Ed and the ePatients at Medicine X, and it was this sense that these are central voices that are rarely heard in the context where they're supposed to be the whole point, right? Like, people say patient-centered care, we need to do it. How could you have care that is, I mean, that the idea that that's a new idea and that that's now the thing,
Right.
it reveals something about the kind of gaps that exist in the healthcare system today. But similarly with education, isn't it about the students? I mean, how can you not have student-centered learning when they're the whole point, right? So I think that, you know, the realization that actually you need to shift who is at the table when you're figuring out what you're doing in these different spaces was a really key kind of insight last year.
Yeah, great. Well, I think the purpose of this panel was to start the discussion. I think the discussion will continue, hopefully, with the rest of people in this room. I think also with the people on social media. The idea is to say that everyone included is also something that is an evolving conversation. It is not something that is a book that is fully written, and it is not a house that is completely full, and that we need to work together. We need to collaborate. The sofa needs to be fuller, filled with people. So work with us, help us. We need to involve more stakeholders, and we need to accept the fact that this is hard work. This is not easy work, and anyone who says that it is easy is
Larry, medicine is changing so quickly that I think, certainly with respect to education, Medicine X gives us a safe space to talk about some of these difficult issues as they emerge. And you know, traditional medical education doesn't allow us to kind of stretch our minds sometimes, and so we create a great venue for us to.
And I think that the purpose of the rest of today and moving forward is to try to explore how everyone included can make space in medical education for collaboration, to grow the stakeholder mix and innovation. So I hope we have inspired you to think how you can take these ideas back home, to grow collaborations in your own work, and also how you can work with us to move forward together. So thank you.